Hello and welcome to the Semaglutide Weight Management Program from Wellness re-InVented. My name is Leslie Miles and I'm the owner and nurse practitioner here at Wellness re-InVented. We're excited you're here and can't wait for you to get started. In this presentation, we'll talk about what semaglutide is, how it works, some risks and benefits, side effects, the self-injection procedure, some dietary recommendations, my personal testimony, and the next steps. Semaglutide is what we call a GLP-1 or glucagon-like peptide receptor agonist. It mimics the GLP-1 hormone, which is released in the gut after eating. This hormone plays a number of roles throughout the body, including appetite suppression, delayed gastric emptying, decreased glucagon production, and increased insulin secretion. Because of how semaglutide works, it not only suppresses appetite, but also reduces your drive for thirst. This is why it's so important to stay hydrated while taking this medication. Aside from weight loss, we're finding that semaglutide is providing other health benefits, including lower blood pressure, reduced cholesterol, increased insulin sensitivity, nerve cell protection from cognitive decline, reduced systemic inflammation, and decreased likelihood of stroke and heart attack. There are some risks with semaglutide we'd like you to be aware of. In one animal study, rodents on semaglutide for their lifespan were at increased likelihood of developing thyroid tumors. As an added precaution, we don't prescribe to anyone with a personal or family history of thyroid or medullary cancer. We check your thyroid function before you start, and these are routinely monitored by your PCP. There's also a rare risk of acute kidney injury and pancreatitis with semaglutide. We check kidney and liver function before you start, and again, these are routinely monitored by your primary care provider as well. Because you're more prone to dehydration on this medication, it's important to stay hydrated to prevent these types of complications. Lastly, hypoglycemia is possible, although it's rare in those without diabetes. We suggest keeping a snack on hand in the event you feel your blood sugar is low. Because of how semaglutide works, many of the side effects are GI related. We find the most common side effect is nausea, and we combat this in two ways. We start at a very low dose to avoid experiencing these symptoms, and we use a semaglutide that is compounded with B12, which naturally helps relieve nausea. Other side effects may include heartburn, abdominal pain, and bowel changes. Because you're more likely to become dehydrated with semaglutide, constipation is more common. Drinking plenty of water should help. If you experience constipation despite adequate water intake, magnesium is a great option. It may be common to feel headache and fatigue, especially during your first week. This should subside. Again, hypoglycemia is possible, but is uncommon in non-diabetic patients. Keep a snack on hand. Our goal is to tailor your dose to your specific needs and goals. We want to have you on a dose in which you experience minimal to no side effects and still see results. Most people experience side effects the first day or two after an injection, so keep that in mind when deciding when to take your first dose. You'll be administering your semaglutide injections yourself at home. We provide all of the supplies you'll need. If you have never given yourself a shot before, that's okay. I created a simple step-by-step video showing you the whole process, start to finish. Watch it now and refer back to it if you have questions. Our nurse is also happy to show you the process when you come to pick up your supplies. Semaglutide comes in a glass vial similar to insulin. It must be stored in the refrigerator. Pharmacy recommends discarding your vial 28 days after opening. We dose semaglutide in units, just as we do insulin, to avoid confusion. Your first week, you'll take 5 units. If it's well tolerated, meaning side effects are minimal to none, it's okay to increase the dose to 10 units that second week moving forward. We will plan to reconnect after 3 to 4 weeks to discuss dosing recommendations based on your tolerance and results. You will receive an automated email from us in about 3 weeks that includes a link to schedule a follow-up visit. If you prefer just a refill, select that from the drop-down list. Do not think more is better. We have plenty of clients receiving 5 to 10 units that are still seeing great results. Semaglutide will suppress your appetite. As a result, it's important to focus on the quality of the food you choose. We suggest high protein, nutrient dense options to avoid muscle loss. Remember, stay hydrated. It's also important to avoid processed foods that are high in fat. Many clients find that they do not feel well after eating these. Listen to your body. Stop eating when you feel full. You may find you're choosing healthier options naturally while taking semaglutide. Remember, we see the best results with semaglutide when paired with healthy diet and physical activity. What's next? If you have current labs, please email them to us at leslie@wellnessre-invented.com for my review. We check CBC, complete blood count, CMP, comprehensive metabolic panel, TSH, thyroid stimulating hormone, and T4. If you need labs, no worries. We can draw them for you in our East Lansing office for an additional $50 fee. We offer walk-in labs Tuesday through Thursday from 9 to 1. You may also request these labs from your PCP if that is easier for you. Once your provider reviews your lab results and we complete the phone consultation together, you're all set to start. You're free to come to our East Lansing location during walk-in hours to pick up. Payment may be made at the time of booking or at pickup. It's important to us that we offer a program that's supportive in every way. We try to make this process as simple and user-friendly as possible. I like to make myself available to you every step of the way. I'm available by text or email at 517-225-2454 or my email at leslie@wellnessre-invented.com. Text is best throughout the day. I do my best to respond as quickly as possible. Our nurses are also great resources and are available during walk-in hours in East Lansing from 9 to 1, Tuesday through Thursday. I love to hear how things are going for you, so reach out and let me know. I love sharing my personal experience with semaglutide. I actually used it myself for about 8 weeks and lost around 22 pounds. For me, it helped heal my relationship with food. As a busy mom, nurse practitioner, and business owner, I spend much of my time on the go. I found it easy to grab something quick and was eating out way too much. I tied emotion to food, and my diet choices were less than great. While on semaglutide, I found that food noise was quieted. I felt much more in control and didn't tie any emotion to food. I saw food as fuel and ate because I knew I needed to. My portions were cut in half, and I noticed my appetite was suppressed that first week on the medication. I've been able to maintain that weight loss now that I've transitioned off. It has taken work and self-control, but it is definitely doable. I always get excited when clients tell me they did research before deciding to join our program. I think it's important to be well informed about anything we put into our bodies. Here are a few articles about semaglutide for weight loss that I think you should review before starting. We are so excited you're here. Our semaglutide program continues to grow, and we're honored to have you be a part of it. There's a better way, and we're thrilled to offer our community an alternative approach to health. Welcome to the Wellness Reinvented family. In addition to our weight management program, we offer other services that may be beneficial to you. Our IV infusions are great if you're dehydrated, under the weather, jet lagged, or even hungover. We also offer vitamin injections, including B12 for energy, vitamin D for mood and immunity, and our Triimmune injections to get you over the hump. We're happy you're here and can't wait for you to get started. Review the information here and bring any questions you may have to your phone consultation with me. We look forward to talking with you soon. Be well.